We have Dr. Anirudh, he's practicing in Haryana, and we have him with us. So we'll be taking the topic as OAB for a better understanding of our viewers. The very first question, a very simple question is, according to you, what is an OAB, overactive bladder?
See, let me just start with just a small clarification. I'm practicing in Delhi NCR, not just Haryana.
Okay.
When you are in Gurgaon, basically
you are into NCR.
No, I go to Delhi also, and I have a clinic in Gurgaon as
well. Okay.
So, and good morning, and basically OAB by definition is overactive bladder, and overactive bladder basically for a layman what it should mean is that the bladder is not supposed to give you a sensation of being full until it has reached its capacity. When the bladder starts bothering a person or making the person sensitive about the bladder getting filled, and that is in layman terms should be called overactive bladder.
Well, according to you, how does it impact the quality of a patient or a person?
So it can sometimes make life miserable for a patient by the mere fact that the patient is all the time. I mean, I have people coming and telling me, doctor, when I go to any place or for any activity, say I go to theater, I go to a hotel, I go to a restaurant, the first thing I notice or see there is where is the restroom in case I need to go and relieve. If there is a meeting somewhere, the only thing I am worried about is whether I'll be able to finish that meeting in time and are the restrooms easily available or not. So that is the basic thing. That's how it makes people.
So what are the cons of a delayed diagnosis? If a patient is not coming to your clinic and they are delaying their visit, what could be the consequences?
Consequences, it becomes their habit. It has social impacts. They start avoiding going to social functions. It has psychological consequences, and sometimes, yes, it may lead to some serious bladder-related issues also.
Well, what role does the behavioral therapy plays when it comes to OAB?
See, always, whenever a patient comes to me, I would like to start with behavioral therapy and also lifestyle changes. And behavioral therapy, we have seen that usually type A personality or anxious, who become anxious very quickly or are suffering from some sort of anxiety, they have this problem more often.
Well, for our viewers, would you please elaborate the term behavioral therapy? What is it?
Behavioral therapy is basically, how, if there is a problem, okay, there is a problem.
Yes.
But then when that problems comes into your day-to-day life, it changes your behavior.
Yes.
So behavioral therapy is given by asking the patient to, think in a certain way. So basically the patient is counseled to deal with the situation in a particular way. That is behavioral therapy.
Well, what would be your advice to an individual with OAB trying to lead a normal social life?
Is that, yes, visit a urologist, let the urologist conduct his tests, and then on the first visit itself, behavioral therapy, lifestyle modifications, and which are very simple. Basically, you have to restrict your fluid intake if you are too much into it. You have to restrict certain foods, cold drinks, tea, coffee, and these are the things. These are lifestyle modification which the patient is made aware of, and then as and when medicine is required, the patients do respond very well to the medicines that are.
Thank you so much, sir. Thank you so much. It was amazing having you with us.